Good afternoon, North Dakota. Hope you had a great Mother's Day weekend. It's been 11 days since we began North Dakota Smart Restart. Today we're going to get a chance to report on numbers from Saturday, Sunday, and today as we kick off today's press briefing. And I want to just say the numbers are looking good for North Dakota, and this is a credit to all North Dakotans, business owners, their employees, our healthcare workers, everybody involved in K-12 and cross-industry. So anyway, great job, North Dakota. These are your numbers, and happy to share them. Also, we've got Superintendent Baser will be speaking today, and Chris Jones, who leads Human Services for North Dakota, is here to take questions. We've got one executive order we're going to talk about and some other announcements. But this afternoon, we're reporting, as was reported today, at 11 o'clock, yesterday's numbers, which was the 24-hour period of Sunday or Mother's Day. We had 27 additional cases of coronavirus disease or COVID-19 out of 2,145 tests that were completed yesterday. This brings today's rate down to 1.3%, the lowest we've seen since March 29th. Sadly, we must also report 3 additional deaths that have passed away over the weekend, resulting now in a total of 36 North Dakotans who've passed away with COVID-19. On Saturday, a man in his 90s from Cass County. On Saturday, a man in his 40s from Cass County. And today, a man in his 90s from Cass County. All had underlying health conditions. And our hearts go out, of course, to those loved ones and all the loved ones of those who've lost someone during this pandemic. Just as a technical note, I would share, my monitor's not working down here, so I can't see slides. So that might be helpful, but thank you. Over the weekend, look back on Saturday's numbers. On Saturday, we reported 40 additional positive cases out of a total of 1,432 tests. That would be 2.8%. And on Sunday, we had 27 positive cases out of a total of 936 or 2.9. And of course, today we had that number, which is the 1.3%. So if you add all of that up in the lower right-hand side of that corner of that slide that's up right now, we've conducted 47,000 plus tests at a 3.2% rate, and that continues to drop. At 3.2%, North Dakota's cumulative average since the beginning remains the 5th lowest in the country, again behind the same 4 states, Alaska, Hawaii, Montana, and West Virginia. On the next slide, on net case breakdown, again, we're now at 636 active confirmed cases, and of course this is down from our peak. Also on this slide, we see we've got 34 people that are hospitalized. There have been some, again, puts and takes on that over the weekend where some people have moved in, some have moved out, and as of reporting that we had this morning, that I think was yesterday afternoon, of those, only 7 of those were in ICU, and of course, anyone who's hospitalized, we're hoping for you a quick and speedy recovery. And again, 34 people hospitalized with COVID out of all the hospital resources, again, represents single digits of our available capacity in the state, and so great job to all of our medical providers. When we take a look at the North Dakota case trends, this is the chart where we show positives netted out against recoveries and people who've passed away. And again, this is exciting on this chart because you can see what's happened over the weekend. We've added 3 more days to have it be our 4th day in a row where recovered cases are outpacing new cases. And so this is a great spot for us to be in as we continue to see the number of active cases drop down. But again, we had a drop in 3 active cases yesterday and a drop of 10 on Saturday, and then combined with the ones we have today, again, 4 days in a row of a drop. When we take a look at the positive rate, which is again one of the gating factors that has been used nationally, today's rate is 2.4%. This is a reflection of the 14-day rolling average, and it's again shows a great decline, and with today's 1.3% positives helped move that down. We talk a lot about testing, and we've talked a lot about how the North Dakota has made this a priority on testing. We've talked about how we've become a national leader in testing. North Dakota continues to rank 3rd in the nation in testing per capita. And I want to thank all the people that are involved in this, whether it's our National Guardsmen, our healthcare providers, our rapid response team, the people that are working around the clock, literally 3 shifts a day at the state lab, or just you, the citizens, because one of the ways we lead in testing is when people need a test, they reach out to their provider and get tested. And so this is Rhode Island, a small state, also the home of corporate headquarters of CVS, has been very aggressive on some of their, and very successful on some of their drive-through testing, so we're looking more to learn from them. New York, of course, which has been in the center of this outbreak at 6%, North Dakota closing in on New York and 6%. We've got a shot in the next week to move into the number 2 spot on this. But why do we talk about this? We talk about this because this is the foundation for the health and safety of our citizens. It's the foundation. Testing is the foundation for North Dakota restart and safely reopen the economy, and testing going forward is going to be how we get people back into schools and back into other things that we do, whether it's K-12 or higher ed, that involve lots of people together. Testing is key to that. We are fortunate that we've been able to muster the resources and the people and the equipment and the supplies to test nearly 6% of the citizens of our state, and this is a substantial compared to the 3 at the top really break out. When you take a look at the region, South Dakota, which is number 2 in our region, they've tested about 2.7% of their population, and so at 6%, we've tested almost the triple the number of people that have been tested in per capita in Wyoming, Montana, or Minnesota, where we're closer to 2 out of 100 have been tested versus in North Dakota 6 out of 100. Why does testing matter? When we do testing and we're able to identify positives, we're able to identify also the people who've been in close contact with those positives. And this is, again, as we've ramped up and mentioned earlier, that in terms of capability, we're currently viewed as number 1 in the country in terms of our contact tracing capability. And that, again, is going to help us corral this virus and make sure that we can do targeted quarantine as opposed to the generalized period of time that we just came through as we were building up our testing capability. Maintaining more than 2,000 tests a day and growing to 4,000 is going to involve us overcoming a series of challenges, whether that's supply chain, keeping equipment going 24 hours a day, having enough trained personnel, and the ability to do outbound targeted collection. But we also need your help on this as well. And again, we need people to get tested, and it doesn't matter how much testing capability we have if we don't have tests to run. And so it's important, if you are feeling symptomatic or feel you've been exposed to COVID, to reach out to your provider, call before you go in, and figure out a way to get tested. Targeted testing does continue. It's continuing, of course, across long-term care across our state, but also in working with communities. As we did on Saturday, we had a outbound effort in conjunction with Standing Rock, and I want to thank Chairman Mike Faith and his team. He had everybody from his game and fish to his DOT to his health department out there helping. Really well-organized event, went very smoothly. I want to thank the North Dakota Department of Health and North Dakota National Guard and others that were down there to make that effort go so smoothly. And as we take a look at long-term care, this is another area where we're focused on. And again, we have had really good success in getting through and getting testing across long-term care, but we've got a little ways to go. We have 44 long-term care facilities yet to be scheduled to be tested. 174 of the 218 in the state have been completed. We do have 3 that have refused to be tested, 2 in Minot and 1 in Fargo. In terms of testing long-term care, we're talking about testing all residents and all people that work in long-term care. Today, during a call, the video conference call that governors have with Dr. Birx and Secretary Azar and Vice President Pence and many others from the coronavirus task force on that call today. They had put out a challenge or a guidance for all governors in all states to try to complete testing of everybody in long-term care over the next 2 weeks. We had already begun that initiative here under our own, part of our own strategy several weeks ago, so we'll be well ahead of the national goal of having everybody tested in long-term care by the end of May. Our goal is to be there by May 15th. And so again, when we talk about people getting tests from their healthcare provider, one note we would mention from the coronavirus task force of family healthcare in downtown Fargo has had a number of people calling from the general public and showing up there for testing. Again, we would encourage people to call your regular healthcare provider because the family healthcare clinic has got limited resources, and they serve patients that cover over with language translation. They do this beautifully over 22 different languages. They've got a lot of existing patients. They operate a homeless clinic, and they do a fantastic job of all of that. But if you've got a regular healthcare provider, call them, particularly in Cass County, whether that's Sanford or Essentia. But again, we encourage everybody to get tested if you feel a need to do that, and please keep making that effort. As next topic, as some of you may have heard, I've been invited to meet with President Trump on Wednesday, and I look forward to highlighting these successes and the efforts and the great work of North Dakotans to be among the nation's leaders in terms of testing, contact tracing, and reopening our economy through the North Dakota Smart Restart. Also, I'm sure we'll have an opportunity to thank those in person, some of those other leaders across federal agencies, including CDC or FEMA, Dr. Birx, and others that have been great partners with the states as we go through all of this. And of course, given what's going on at the White House in managing the pandemic, these meetings are always subject to change and or cancellation, and so we'll keep you posted if this meeting holds. The other governor that's been invited to that meeting is Governor of Colorado, Jared Polis. Next up, we're going to talk about executive order. And as we continue with our North Dakota Smart Restart, of course, our top priority continues to be the health and safety of our citizens, and that includes all of those 120,000 K-12 students who've been distance learning since April 1. Last week, we made announcements regarding guidance around graduation, and we know that a lot of great plans are coming forward in terms of people figuring out how to hold meaningful ceremonies for the over 8,000 seniors across North Dakota, and to be able to do that in school facilities with proper social distancing, cleaning, safety precautions, or holding those events outdoors in outdoor facilities. With summer approaching, there are various programs that normally utilize school buildings, and today I signed an executive order to allow those activities to proceed in what might be called a soft opening of school facilities. This will help get us open for next fall, and it'll ensure that students can receive education and some really important programs can keep going on through the summer. And just to give people a sense of the scope of this thing in terms of some of the programs that you're going to hear about, there are over 16,000, almost 16,500 students last year in North Dakota took some form of summer school where they were engaged with the building. People, what they call the extended school year, about 2,300 21st century learning programs, almost 3,000, and lots of other activities, including testing. So again, we're talking about over 20,000 students last year were in our buildings over the summer. This is about 1/6 of our normal capacity, and so again, this is going to give us an opportunity to learn how we can open and how we can manage with perhaps smaller numbers, but still really significant numbers. As we moved into the announcement and executive order that we made today, again, I want to thank all those that were involved in K-12 and the key partnerships here, starting, of course, with Superintendent Baszler and her team for the great work that they're doing, but also want to thank the School Board Association, all of the the school administrators, teachers, and the teachers union, and of course parents who we listen to about this as well. And of course Superintendent Baszler always getting input from all these groups through all of her boards and her calls and her listening groups, including families. But again, so we've got some additional flexibility that we want to announce, and here to talk about that is Superintendent Baszler. Thank you for being here today.
Good afternoon, everyone. Again, thank you. And thank you to Governor Burgum. I really do want to start off by saying thank you to the governor's office and our partners at DHS as well, as we've worked together for the past several weeks, and again over this weekend, to align our K-12 guidance with child care expectations. As you know, many of our school districts offer and many students depend on the availability of academic programming during the summer months. The summer programming have allowed students to reinforce skills and learning as well as to accelerate their learning. And additionally, this past spring, testing sites for required college admission and career readiness tests have been unavailable to our students graduating from high school due to the COVID-19 pandemic. In response, local school districts have become or are seeking certification as testing sites in anticipation of the possible opportunity for them to be used for their students. So as the governor announced, at the discretion of our local school boards and school superintendents, public and non-public school facilities may offer on-site summer programs as identified in this order, provided that the school district strictly adhere to the Department of Public Instruction's K-12 Smart Restart guidelines, specifically the health and safety logistics, which is Section 4 of these guidelines. We collaborated with many partners to create these guidelines, and those partners included, of course, the governor's office, the Department of Emergency Services, of course, the North Dakota Department of Health, our North Dakota Regional Education Association, and the K-12 Coordination Counselor. These guidelines are aligned to our North Dakota child care guidance, which will limit the group size for, as the governor called this, soft opening. The group size limit will be 15 people or less. These on-site programs may be offered during the summer months beginning June 1st, 2020, and they include summer school classes, extended school year programs, as indicated by IDEA, 21st Century Community Learner Center programs, Head Start programs, child care programs licensed by the Department of Human Services, summer student center programs, and of course the administration of academic standardized tests such as ACT, Work Keys, and GED. As the governor mentioned, there were many students that were waiting to take these standardized tests. Over 1,100 students are waiting to either take their ACT, the Work Keys, or the GED to receive their general equivalency diploma. In addition, from May 15th to May 30th, school buildings may be opened to students to allow students to return school property in their possession and to allow student property currently in the school building to be retrieved. I want to underscore that nothing in this order requires that a district open for summer and offer these programs, and nothing prohibits a school with approval from the Department of Public Instruction from offering summer school courses by distance learning. So with that, I will hand it back to the governor. Thank you.
Thank you, Superintendent. And I want to just put a little extra emphasis on the last piece that the Superintendent covered, which is the May 15th to May 30th. This might be returning computers, laptops, books, textbooks, coming to clean out your locker. May 15th to May 30th. Again, I know that school boards and school administrators will think about this thoughtfully and stage out the number of students that might be showing at any one time. And again, if there's ways to get this done without having students in the school building, I know when they were distributing stuff, sometimes they were doing that with tables outside. Again, use the North Dakota SMART guidelines, use all the information that was in the in the guidelines that were issued last week to help guide you through that, and with the idea, again, that we're trying to create a separation period between when the general population of 120,000 students that may have something that they need to return or come and go, that ends on the end of May, and then summer school starts on June 1st. We're trying to not have those two periods overlap. And so again, more details in the executive order or on the DPI website. But again, thank you again to all involved with K-12, everybody involved that's in there professionally, and all the parents who've done such a great job. Thank you. But exciting that the numbers are such that we can start thinking about how do we use the facilities to support education this summer in a limited fashion that will also give us some learning about how to get ready for the fall. Next topic, child care. The topic is child care, right? So when last Friday, Child Care Provider Appreciation Day, we expressed our gratitude to the thousands of child care providers, teachers, and educators of young children everywhere for their hard work and dedication in providing these essential and important early experiences to help children realize their potential. So much research that would say that if we can invest in making sure that children between the ages 0 and 5 have the very best possible experiences. It's going to, from a state standpoint, it not only creates a great life for those children, but it also, from a state standpoint, will lower costs in human services, in healthcare, even in corrections down the road. And so we all know those early years really matter. This pandemic has made us even more aware of the vital support system that stands behind so much of our workforce, and that's the North Dakota child care providers. And on behalf of the state of North Dakota, again, I want to express my gratitude to those professional and dedicated child care providers who nurture and care for and challenge our children, particularly when they're providing essential support for those hardworking North Dakota families who kept on working during this entire pandemic. We announced the Child Care Emergency Operating Grants back earlier in March, late March, and we did that. We announced modified operating practices aligning with the CDC and our own North Dakota Department of Health recommendations. When we announced the emergency operating grants, that was to help sustain child care services, particularly for those that were in essential industries during this pandemic. Our goal was to protect the health of the children and families and child care workers, provide for the health, safety, and lifeline, as we call them, lifeline worker households, and help sustain the child care sector so that when we came out of this, we would actually still have a child care sector. There's over 1,800 organizations in North Dakota that provide child care. To date, Department of Human Services has provided almost $9 million in emergency operating grant funding to over 700 licensed and self-declared child care providers in North Dakota who remained open to serving children and families and who chose voluntarily to opt into the Child Care Emergency Operating Grant Program. So again, thank you to those 700 plus child care providers who opted in and kept operating. Since March 30th, when the program began, child care providers across the state have reported more than 11,500 children have been attending child care. 70 to 75% of those consistently have been children of people that work in health, work in safety, or what we call lifeline worker households. The emergency grant program was originally anticipated to run through the end of May. Today we're announcing that the Child Care Emergency Operating Grant Program is being extended through July 3rd to qualifying participating providers who remain open and are serving children and families. Executive Order 2020-27, which I used on April 9th, outlined the need to utilize modified operating practices in child care settings. This included essentially reducing the amount of density allowed in a licensed child care practice to create more opportunity for physical distancing. Those modified practices will remain in effect at least through July 3rd, coinciding with the extension of the operating grants. However, there are going to be some changes to that and some modifications, some loosening up, if you will, for child care providers. Today's executive order allowing for the limited use of K-12 facilities, which you just heard Superintendent Baszler talk about, starting June 1, will allow dozens of child care programs licensed to offer child care from within K-12 buildings to restart their operations. They will still need to follow the modified operating practices published for child care as well as the practice established for K-12. But this is an important step towards a phased returning to our current capacity for child care. And to reflect an updated understanding of where we are, they're including in the new modified operating agreements, the updated screening questions to reflect a broader set of COVID-indicated symptoms, updated guidance related to off-premise activities like trips to local parks, and we are also importantly increasing the maximum group size in child care settings from 10 to 15. This does not supersede the staffing ratios that were established for provision of licensed child care in North Dakota, but will allow programs some additional flexibility in how they think about cohorting children and adults in their programs. Our goal remains the same: protect the health and well-being of children, family, and child care workers to help ensure that health, safety, and lifeline workers continue to serve the community in the state. Because this essential workforce support, we need to make sure that they've got their essential child care in place. Child care in North Dakota restart. Again, as we move forward with the North Dakota Smart Restart, businesses and employers are taking steps to safely reopen. Parents are returning to work, and we need to continue to value and support the availability of quality child care in the state. We know that this temporary emergency operating program, while helpful, has not eliminated all the challenges. On April 1st, there was 1,572 licensed care programs in North Dakota. As of May 7th, 165 of those have self-reported that they have remained closed. Those closures were voluntarily. We know that they represent about 15% of the total licensed child care capacity in the state. And so we're going to continue monitoring child care needs and capacity as we move through this. And again, if you're contemplating your own smart restart, if you're one of those 165 that is closed, or if you and your family are looking for childcare, you can always visit the Child Care Aware Resource and Referral Online Database at ndchildcare.org. If your child has special needs that you're trying to address, you can also call them and get personal consultation free of charge as we try to identify a child care option that would work for you. Again, I want to close in this section by saying thank you to all the child care providers for being there for all of us and for helping to ensure that thousands and thousands of the youngest North Dakotans have days filled with great experiences that we know will impact those children as they learn and grow for years to come. And again, as I said, DHS Executive Director Chris Jones is here in the room. He'll be available to answer questions. Census update. We've talked about this before, but we can't lose sight of how important this is to North Dakotans when we're in the middle of this pandemic. We don't want to lose sight of the fact that every single person that gets counted in the census can represent up to $19,100 of funding to North Dakota from federal programs over the next decade. This unlocks funding for highway planning, instruction, school lunch programs, special education grants, housing assistance, and much more. The Federal Census Office will resume some field operations starting in June, but you don't have to wait for that. If you haven't done so, you can go online right now and complete your household census. This eliminates the possibility that census workers may come to your home this summer, and you can get it done going online. And again, it's one per household. So if your household has not completed one yet, talk with the other adults in the household, assign clear accountability, figure out who's going to go online and represent each of you, because each of you count. Make sure you get counted. I want to give out some shout outs. Again, first at the county level, Burleigh County is the #1 county in our state. 73% is the estimate for the number of people that have completed their response rate relative to addresses in Burleigh County. That's fantastic. So they're leading. We're still as only one city in the entire U.S. which has a 100% response rate. Congratulations again to North River, North Dakota. Harwood, North Dakota is currently in 7th place in the nation with an 89% response rate, but we understand their city auditor, Casey, keep it going over there. He's got a goal to get to 100% and has launched even community contest with prizes. So that's at my2020census.gov, one per household. You count, make sure you get counted. Next topic, relates to North Dakota Department of Transportation, Smart Restart. We announced on Friday that they were going to be again open for business in person, and no surprise that this morning the NDDOT started receiving a large amount of calls. Almost 300 to 400 calls an hour were coming in this morning. So I want to let people know, if you had trouble getting through this morning, we're adding more staff to help with the call center and looking at other options to handle volume. The average in terms of number of calls that were coming in this morning was 4 times more than normal call volume. As we've learned throughout this pandemic, whether it's the health hotline, whether it's the unemployment insurance phone lines, or now NDDOT, that again, we have some information technology needs relative to modern call center technology, where we're coming up short. So this creates an opportunity for us to try to, again, improve the services we're delivering to the state of North Dakota with upgrading some of these capabilities. Before noon today, NDDOT had connected with more than 1,000 people, more than 1,000 appointments for driver's license and motor vehicle services were made this morning. But again, as part of this essentially a public service announcement, I want to repeat with emphasis what I've said in the past is driver's license and motor vehicle tabs that were due after March 1, 2020 remain valid, do not need to be renewed. So if you are calling this morning about your tabs or your driver's license need to be renewed at this point in time, as long as my emergency declaration is in place that waives those, then you're in fine shape and don't need to get those done. Also, people were calling this morning about getting Real ID. I want to repeat, the Real ID, which is the federal program to achieve, which nationally was needed to use your driver's license, had to be a Real ID driver's license issued by a state to fly. That deadline got moved back an entire year. So it is October 1st, 2021, not 2020. So if you don't have a Real ID, you can just chill because you've got a year and a half to get that taken care of, and you don't need to overwhelm the call lines this morning as we take care of other high priority items. And other good news, the federal TSA has announced that they'll allow travelers to board a plane right now during this pandemic with an expired driver's license. Again, so if yours expired after March 1, you can still use that to fly right now. Okay, next up, behavioral health update. Parents, family members, and other trusted adults play an important role in helping children make sense of the changes in their lives in a way that is honest, accurate, and minimizes anxiety and fear. And I'm sure as a parent, you've had many opportunities for those conversations, but this is a reminder that if you need help in getting age-appropriate coaching on how to hold those conversations with children of all ages, not just the youngest ones, parentslead.org. Parents Lead provides parents and caregivers with tools and resources to support them in promoting the behavioral health and well-being of their children. And new resources have been added to this since the last time we brought it up here, including new topics around teleworking from home, while also taking care of your children, creating calm, recognizing your own signs of anxiety, ideas for keeping physically active while socially distancing, and tips for dealing with an adult child who recently moved back home. And I know a lot of parents have had that experience as well. Again, that website, parentslead.org, or follow the Parents Lead on Facebook, Instagram, or Pinterest. Good news section coming up next. On the good news front, you maybe heard some of the announcements that was talked about this morning in our call with the Vice President about one drug that has shown promise in fighting COVID-19 for those that are severely ill is remdesivir. It's a broad-spectrum antiviral medication. North Dakota will be receiving a shipment of 10 cases of this potentially life-saving drug, and it'll be enough to treat 50 patients. The Department of Health is working with our North Dakota Physician Advisory group to determine how the drug will be distributed, and the drug is coming to us through U.S. Department of Health and Human Services in FEMA. It was made possible by a donation from the drug's creator, Gilead Sciences, a U.S. company. Remdesivir, of course, doesn't cure COVID-19, but the drug may speed up recovery. The FDA authorized emergency use of the antiviral drug 2 weeks ago after a clinical trial found patients treated with remdesivir had a 31% faster recovery than those who received a placebo. And so because of this, it's a highly sought after drug, and we're grateful to be receiving this shipment and hope that it can positively impact North Dakotans who become severely ill with COVID-19. In closing, I would want to talk about gratitude. And again, as we move into our second week of North Dakota Smart Restart, we encourage all North Dakotans to think with gratitude of those frontline workers. If you did get back out, and whether it was to a bar, a restaurant, a retail store, or any place that you might have been, or those that are providing services throughout this entire time, whether they're on the front lines of healthcare or the front lines of education. If you run into any of those people, again, if you can have a little extra patience, a little extra empathy, and a little extra courtesy and kindness, that would go a long way, because we know that these people have had their own sets of disruptions in their life. And Cicero, who was a Roman philosopher and leader that lived between 106 BC and then died in 43 BC. We won't go into why he was beheaded, but before that point in time, he did have a great quote on gratitude, which says, "Gratitude is not only the greatest of virtues, but the parent of all others." And as we think about all the parents out there that are teaching lessons to your kids, I hope you're grateful for your parents. And again, we're grateful for all of you. And so again, thank you all for being here. And now we'll stand for questions. We're going to go with Dave, and then we're going to go online, and then we'll
drug, and when do you expect it, and how is it going to be distributed?
Yeah, remdesivir. I'm going to go back here. I learned of it this morning on the call with the Vice President. Again, FEMA and U.S. Department of Health and Services are sending that out. It's going to be how it's going to be distributed. Here is we're working now that we've learned that we have this coming. We have a physician advisory committee that was standing prior to this pandemic, and they're going to determine how the drug will be distributed to local hospitals. I'm anticipating, again, they'll do the thinking on this, but given that we've got, as we described here, low number of hospitalizations and only a few of those in ICU, that likely that if we've got the ability in this first shipment, there's more shipments coming, but in the first shipment, we've got enough to be able to treat 50 patients, that I would think that would be working with medical providers to see if that could go to the people that are most critically ill, because that's where it works best. And so it's perhaps that the state will hold some of this and then distribute it in terms of where people are becoming most critically ill. Okay, online.
Mike Smith, 660 KUYZ in Williston. You had said last week larger scale events should wait until Friday for guidance, and yet the North Dakota State Fair has today canceled. Do you think with this news people should start hoping to see a new normal for weddings, fairs, and other big gatherings this fall rather than this summer?
I can't say that because Mike, on your question, because I understand, I learned just coming in here that the Red River Valley Fair, I believe, is also canceled. I think there are special circumstances there. These large events like that where they've prepaid dollars for acts, carnivals, etc. There's a different set of economics for them, and I believe that when we looked at the really large scale, the tens of thousands of people gathering this summer, it was the determination of the Department of Health that those were unlikely to free up and actually happen, because it's very hard to do some of those events in any way, shape, or form they've done in the past and maintain physical distancing. And so if they received a letter from the Department of Health recommending they not open, then that's also something that they were looking for, because then that helps them economically get out of commitments that they may have had, whether it's to financial acts or carnivals or others that are coming. So I put that in a different category than say weddings or even farmers markets. I mean, farmer markets can have fairly large attendance, but farmers markets generally, because they're part of a essential food distribution, those have kept going around the country, particularly in the southern parts of the country where they might be a year-round thing. Those have kept going throughout this, and I would expect, for example, that farmers markets will be open this summer because they were never closed, even in parts of the country that had outbreaks. So it really varies by event, but again, we'll still be looking to Friday to provide more guidance. But as it was when we came out with the North Dakota Smart Restart, we had different guidance for different categories and different types of business, and I'm sure here that there won't be a one-size-fits-all for even a thing called larger groups. There's going to have to be some granularity underneath that when we give guidance on the types of events that could go forward or not.
Point of clarification, the Red River Valley Fair is not announced canceling, just considering.
Okay, thank you for that. That was Mike, the masked Mike, if you couldn't hear it, was saying that Red River Valley Fair is not canceled. They're just thinking about it, so I didn't mean if I jumped ahead on that one. Okay, I'm going to go Lane and then Jacob, and then Jeremy.
Over the past few days, we've had some low total testing numbers, and now today we're back up over 2,000. And on Friday, you had said one of the machines was getting looked at. Is everything back on track and running properly?
Yeah, things are going, and we've got good capacity for this week. I think as part of my remarks today, again, I want to just encourage citizens that if you are symptomatic at all, or you think you've come in contact with someone who is positive, be sure to go out and get a test. Just because our numbers are dropping doesn't mean people still shouldn't be very careful about getting, and very proactive about getting tested, because you don't want to be the person who has this and doesn't know it, particularly if you're young and healthy. You might say, hey, I don't really I'm not going to go to the hospital and whatever, but what you need to know is whether or not you're spreading it to other people. If we want to get this thing wrestled to the ground, we need to make sure that people that think they need a test get tested. So contact your provider, get tested, because if we're going to go from 2,000 to 4,000 at a time when there may be dropping demand from people. 3 weeks ago we had a lot of people that I put in the worried well, that they were well, but they were worried, and they were banging down the doors on how do I get a test. As that diminishes, we need to make sure that people that are concerned about their health or about exposure to this disease get tested, because we don't want to have unused capacity in the lab, that it would be the reason for low test numbers. And we'll continue to target it outbound. We'll have numbers that are coming in because of the Red River Valley task force. We'll have numbers coming in because of our 44 more long-term care facilities, but we really the citizens need to do their part as well. Jacob.
Governor, with fairs announcing that they're closing or considering closing, does that at all change an earlier need for guidance on larger venues?
I don't think so. I think we want to stick to Friday and be thoughtful, continue working with all these industry groups, and so I would look for that guidance on Friday of this week. Jeremy.
You had mentioned last week in a conference call the number of people who have died in long-term care facilities in North Dakota. I'm just wondering if you have an update on that number at this point.
I know we can get you that number. I don't have it off the top of my head. Going to go online. Oh no, hey Andy, let's go to Andy.
Were you given an explanation on why you were asked to visit the White House? If so, what was it?
No, we're not. We were not given an explanation.
Williston Herald, we're noticing a drop-off in people following social distancing recommendations and fewer people wearing masks. Are there any penalties for not following this guidance, and is it still important to continue to practice social distancing?
What we're going for in North Dakota is, we've always said, a high degree of individual responsibility and a light touch from government, and I'd say it does matter that we still practice this, particularly if you've got family members who are either in an age group, if you're over 65, or if you've got underlying health conditions. It's super important, because we know that this is we know that this disease can lead to death, and so we again want to protect those people. So I'd say yes, it still does matter, and I think the other thing that's been good, we've seen a lot of good practice where people are have developed, I would say, their pod, whether it's family members or close set of friends, where everybody in that group is all committed to a high degree of responsibility, social responsibility, individual responsibility of taking care of themselves and those around them. And I think that's one of the reasons why we're seeing the numbers drop across the state, and in many parts of the state, they're dropping very dramatically. And I think, again, this is compliments to everybody in the state who's doing a great job managing all of this. Jacob?
Governor, a few weeks ago when other states were announcing that they were considering opening up their economies and North Dakota was preparing to do theirs, you mentioned that there was a consideration of doing a regional approach with other states kind of doing similar things at similar times. Our neighbors are at different stages and making different moves. Minnesota's stay-at-home order is in effect for a few more weeks. Wondering if there's still any kind of update to taking a regional states approach to the next phases of reopening.
I would say that it's more on a neighbor to neighbor versus regional, because right now what really matters in some cases what's going on our borders, and that's why we've continued to maintain collaboration with our neighboring states. And two examples of that, I guess, would give, with Standing Rock on Saturday, a number of the people that got tested on Saturday that came and got tested are South Dakota residents, and we welcome them as part of that, because Standing Rock is its own sovereign nation, spans across both states. We're going to be exploring doing something similar with Sistan Waptan Oyate down at Dakota Magic, so reaching out to them as well. And of course, what we're doing with the Red River Valley COVID task force, when we had Moorhead coming on board, plans are moving ahead to do over 800 tests in the Clay County side in long-term care and with long-term care workers, and that's in conjunction with Sanford, with Mayo, with the state of North Dakota, Clay County Health, Cass County Health, Fargo, Moorhead. We got everybody on board on that one, because again, we've got to just treat that as one metro area, not as two different states. So I'd say it's going well with the neighbors. Steve Bullock is always a text or phone call away on the Montana side. It turns out that again we have the amount of population residing on the Montana border versus the North Dakota Minnesota border is very different, and there are a number of counties on both the North Dakota and Montana side that right now have 0 active cases, and so I'd say things are quiet on the western front.
Follow up on that with the neighborhood camaraderie. Do you know how many individuals from other states are hospitalized in North Dakota?
I do not. That number may be available, but it's not a number that I've been regularly briefed on. I've roughly used in our planning back when we were talking about hospital planning that roughly at any given time, somewhere between 30 to 40% of the hospitalizations in Grand Forks and Fargo were Minnesotans. Dave? And then Jeremy. Did I miss you, Jeremy? No? Okay, all right. We're coming back to you after this, then online.
Governor, with two facilities in Minot refusing to be tested, one in Fargo, A, did they give you reasons? B, how does this match with the goal you have to get all of them done by May 15th?
I don't have the reason. I just got that briefing right before I walked in here, and it wouldn't match with our goal, and it wouldn't match with the federal goal, because again, the vice president today indicated that there would like to see all 15,000 facilities in the United States tested, and so I'll have to dig in a little bit more about that and see if there's some concern they have about methodology or approach or who's doing that, and maybe it just requires some more conversation to get to a yes.
Tools in your toolbox to get that testing done?
We have to explore that. Again, this is just came on my radar right now. I have to say I was a little surprised, but also just jogged my curiosity to find out. Makes me want to ask questions about what the concerns would be, and then see if we can address those.
I'll follow up on that. What are the names of the nursing homes that refuse?
I was not given that as part of the briefing. I got 2 in Minot, 1 in Fargo. That's all I know at this time.
And then the other question I wanted to ask. I guess Cass County accounts for more than half of the active COVID-19 cases in the state, and still about 21% of the testing that's been done. How does the state plan to close that disparity?
Well, we're going to try to close it this week with a COVID task force, because if we've got over half the actives right now, over half the actives in the state are in Cass County right now, then I told the team, I said, then half the testing should be going on in Cass County this week. Of what our capacity is. I mean, we have to drive our testing to the place where, because where there's a positive, then there's people who've been in contact with that positive. And I said, if we're going to wrestle this thing to the ground, we got to drive more testing there. And I know, early on, people are saying you're going to do testing all over the state. We've done testing all over the state. We have 18 counties that still have 0 positives, never had one once, even though we've done testing everywhere. But if we want to get this thing down, we got to hit that. And again, that's, as you heard, from last week from Chairman Peterson, Fargo is a genuine metro area. Fargo, West Fargo, Moorhead. I mean, you've got close to 10,000 people commuting from a half a dozen counties as much as an hour away coming to work there. So we really got to figure out a way. If we can't control it there, then that whole region is going to continue to suffer. And so that's why, again, with good focus on testing, good focus on contact tracing, targeted isolation, we can see those numbers coming down.
To that, does that mean that Cass County residents can expect to have more large testing events this week?
I think we're going to continue to drive with the targeted, which is, again, trying to really identify. We got the contact tracing, and when you see a number of positives, you should just in your head go that we've probably identified at least 6 other people through contact tracing that need to be tested. So just take that number and multiply it every day, and take it back through last week, and we're still trying to chase all those folks down. I mean, we're not literally trying to chase them down. We're trying to arrange for people who've been in contact with a positive to have an opportunity to get tested. I'm going to go online and then back to Jacob.
Scott Hennon, WZFG KFYR Radio. What is your top request for President Trump at the White House on Wednesday?
Well, thanks, Scott, for the question. We're still working on that, and in terms of how we would frame it, in terms of when we find out how much time we have, certainly there's an expectation that we're going to give a quick briefing on the great things that are going on in North Dakota relative to the virus. I would think that it would be important for us to shift and talk about the economy going forward, because obviously there's things in ag and energy that we need to talk about in terms of getting those sectors going and growing again, because that's going to be the bigger long-term challenge for our state. I'd say in terms of how the state's handling the virus, we get a very strong report card, as we've talked about every day here, whether it's the amount of testing we're doing, the contact tracing we're doing, the healthcare system, the K-12 and higher ed going to distance learning. There's a lot of positives to share with the administration. Some of that was reported out this morning to the vice president. So we've been in a position where we're giving regular updates to them on how we're doing. So if we get that time, I think it'd be important that we talk about the economy going forward.
Talking about the cases in Cass County and their numbers being higher than the rest, obviously a number of people plays a role, but was there possibly a hot spot in Cass County that played a role in the high number in Cass, or is it just kind of how the city is laid out?
I think it's really related to long-term care. I mean, if we take a look at the facilities across the state, and then the number of long-term care facilities that we have in Cass County, and then the number of people that work in them, because they're large facilities, you've got large staff that's working there. I think that's what we're seeing. I think the number is close to 200 of the Cass County cases are related to either long-term care residents or long-term care workers. So part of that task force work is going to be to really target those, target particularly the workers, because if you've got workers at the lower end of an economic spectrum that might be doing custodial work or in a long-term care facility, and again, recognizing that our state had very low unemployment going into this thing, and so that these jobs hard to fill. Sometimes people might have had 2 jobs. You might have had somebody who was working in 2 long-term care facilities in food service or custodial, and then if they're going back home to a multi-generational living situation, the compound the challenges. So we're really, that's part of the great work the contact tracing team is doing, is making sure we can identify these things. But the first place to look in Cass County is in long-term care. That's what's jumping out of the data right now. Going to go online and then Lane.
Brad Nygaard with the Crosby Journal. On May 3rd, 95 residents and staff were tested at a nursing home in Crosby. But according to staff, as of noon today, there are still no results. Is this a failure of process or of delivery method?
What was the date on that question from Brad?
May 3rd.
That seems to me like I got to check on that, because that doesn't make any sense to me, because anything collected on May 3rd would have already been run through the lab. So maybe there's a communication breakdown there, but let's our team will take that one as an action item, and we'll get back to Brad and find out, because that should have been, those results should have been reported a long time ago. Lane?
Governor, have you heard any updates on the meat shortage that we're now seeing in grocery stores?
Have not. I mean, generally, I know that Commissioner Goring has been close to this, working with through the Ag Department and the Secretary of Ag. We know that one of the places in America where there have been hotspots, outbreaks, and whether that's in pork processing or turkey processing in Minnesota, whether it's in beef or pork in South Dakota, we know that those have all been in the news, and when those get shut down, then that causes a disruption in the supply chain. And then when people are concerned about disruptions in supply chain, then that's when people tend to buy more meat and put it in their freezer. I understand, through this whole thing, I mean, one of the hot selling items was everybody was going back to getting a deep freezer again, or stocking it up with that, maybe more meat, less ice cream in your freezer, I'm not sure. But I think that again, part of it is getting those things going so people have confidence in the supply chain, so they don't have to feel they have to have an extraordinary amount of protein in their freezer. I'm going to go online and then back to Jacob.
Jean Schemp, Hometown Radio Group. 45 other states provide the number of nursing home deaths to the public. Will North Dakota begin providing this information on the NDDOH website?
I believe the answer is yes. We've shared it here, so I think we'd want to get that information out. And I want to remind everybody here, we've got Chris Jones is available for questions, as is Superintendent Baszler is here, just in case people have forgotten that they're here. So happy to spread the love around. Oh, I did. Oh, shoot. Okay. All right. Well, thank you. Thank you for thinking of him, Lane.
Governor, question on a specific. We've been talking to some bowling alley owners, and they say that they're getting some conflicting guidance as to whether they should wait for Friday to get guidance on reopening, or they are allowed to be open. Just wondering if bowling alleys are being forced to close, or if they are allowed to be open.
Boy, that stumped me on that one. So I will have to check on the bowling alley and what groups they fall in. But that's one we can get back to you. Okay, one for Superintendent Baszler. Super. And it's not about bowling alleys. I hope so. It'll be. But I know this is the time summer leagues are forming, right? So for the bowling alley, so we want to get those open. We'll spare you. Very good. Thank you, Dave. Okay.
Yes.
TGO Radio. We've had many people ask, with summer school, will driver's education be allowed? And logistically, how would that work with regard to the behind the wheel portion of the class?
So yes, I just checked on the number of driver's ed summer schools that we had last year. There were approximately 100 sites of the 400 plus buildings in the state of North Dakota that offered driver's ed. So about 25% of our sites do have driver's ed. Up until this point, we were offering the classroom portion of driver's ed via distance learning, and so now our school districts would have the opportunity to decide whether they wanted to move forward with the distance learning classroom instruction, or if they want to have that in person, as long as they're following the 15-person maximum. I think the bigger question, though, is the behind the wheel. So driver's ed is generally split into two different pieces: classroom instruction and then behind the wheel. And I think it's the behind the wheel portion of the course that has the most questions surrounding it. And so again, we encourage our local school boards to have those conversations with their local school superintendents and their community to determine if they can complete that behind the wheel and in-person classroom instruction following the social distancing guidelines and all of the guidelines that are within our Smart Restart. If I can take a moment of privilege, I have some breaking news that I think is pretty exciting. It's an issue that is important to both the governor and I. I just am pleased to congratulate that Kara Forbear The Newtown Middle School principal has been awarded, welcomed into the inaugural class of President Trump's Cybersecurity Education Award honorees. So at Newtown Middle School, Ms. Forbear spearheaded the adoption of the North Dakota Cybersecurity Initiative that teach digital literacy and safety skills to students of all ages. Under her leadership, educators at Newtown Middle School make real-world connections to cybersecurity in the classroom so that students at this Title I school learn about career paths in this field. She has expanded those opportunities for her students to explore cybersecurity beyond the classroom through the Valley City State University Summer Academy and participation in the University of North Dakota NASA Near Space Project. So I've had the opportunity to work with Ms. Forbear for the last 2 summers, getting a group of Newtown Middle School students on the campus of Valley City State University, and she was recognized as one of only two educators nationally for that inaugural award. So shout out to all of our educators, and particularly Kara Forbear on MHA Nation. Thank you.
Thank you, Superintendent. Congratulations, Kara. That's really fun news. And back on bowling, I guess when I couldn't answer that question, that was a complete strike out on my part. Okay. All right. Mike, do you have a question? Okay. He's trying to veto the last pun. That would be the one question left. One question remaining. One question remaining, and it's going to Jacob.
Mr. Chris Jones.
Yay. Thank you.
I'm wondering if there are any updated guidances for childcare in the not too distant future. Schools now being closed permanently, wondering if that kind of change plays a role in the type of guidance you offer daycare services.
I'm not sure. Okay.
We heard about the grants and that's being extended. Wondering if there's just a change in either the 10 people per room policy or cleaning policies, any kind of updates coming in with the new season coming in.
Okay. So with the modified operating guidelines that were part of the CEOG, those are now melded together with the Department of Public Instruction and how those schools will open up. So we're having the same rules as it relates to. In other words, here's what we're trying to do. We're trying to make sure that we treat children between the ages of 0 and 5 just like children between the ages of K through 12, and recognizing the vulnerability and safety and health needs that they all have. So that we're really trying to put those all together to make sure all kids are safe. Yeah, we are moving to 15 persons, or 15 people per room versus 10 starting on June 1.
Okay, with that, we are conclude today. If the White House meeting holds on Wednesday, we won't have one on Wednesday. We'll keep you posted if things break on whether we have one on Thursday in addition to Friday. For sure, we're going to be here Friday. We may be here Thursday after we get back if that meeting happens. If the White House meeting gets canceled, then we will be here 3:30 on Wednesday. Okay, so we'll see you for sure Friday at 3:30, possibly at 3:30 on Wednesday, possibly 3:30 on Thursday. Thank you all. Okay, take care.